Hello, everyone, and welcome back. I am Juliana. Usually on this show, we invite researchers and clinicians to talk about science, discovery, and advances in exocrine gland research. But today's episode is a little different, and it's a very special episode for us. For this season, we also want to pause and listen more closely to the community we work for. We want to listen to our patients, to living experiences behind different conditions that we study every day. I'm joined today by our moderator, Caio da Silva Barros. Caio is a postdoctoral research fellow at the University of Michigan School of Dentistry. He earned his Doctor of Dental Surgery, followed by a master's degree in oral pathology and medicine, and a PhD in dental sciences, all from the Federal University of Rio Grande do Norte, School of Dentistry in Brazil. Caio is also my lab mate, and one of the things I really value about working with him is his extensive experience with both perspectives as a clinician who had treated patients and also as a researcher focused on understanding disease mechanisms and improving patient care. That combination brings an important lens to today's conversation. Caio, welcome. Thank you for being here. And would you like to briefly introduce yourself and tell us a bit more about your research focus and what you have been working on?
Thank you, Juliana. Hi, everyone. My name is Caio. I got my all my degrees in Brazil. I have some experience with oral medicine and oral pathology, and now I'm working close with Dr. Lombard to seek new alternatives therapies for people that suffering from dry mouth. So basically, we are trying to seek new ways to improve the quality of life of the head and neck cancer survivors.
Thank you, Caio. And as I mentioned, today's episode centers on listening to the patient's perspective. We are honored to welcome our guest, David Pernick. David kindly accepted our invitation to share his personal experience living with xerostomia, the dry mouth, following radiation therapy. David, thank you so much for being here and for willing to share your story with us. I'd love for you to introduce yourself in your own words. You can tell us what you do for work, your age if you're comfortable sharing this, things you enjoy doing, or anything you'd like our listeners to know about who you are.
Thank you, Juliana and Caio. Thank you for the invitation to talk about this. It's been 4 years since I was diagnosed and treated, and uh, an interesting aspect of the whole experience is the question of who are you? Who are you? What is your life? What do you do, etc. And I could tell you that at the time that I was diagnosed, I struggled quite a bit with not being identified as my diagnosis. I didn't want to just be identified or feel that I was my cancer diagnosis. So to that end, my name is David Pernick. I'm a lawyer and a part-time realtor, and I serve on a couple of nonprofits in and around the city of Detroit. It's where I was born and raised, and I've lived all my life in southeastern Michigan. I consider myself a native Detroiter, even though I don't live in the city anymore. Um, I have been practicing law for about 30 years, general business law, but also with some experience in estate planning and wills and things like that. Um, I um, am a big history nerd. The city of Detroit is 322 years old this year, and as being the second oldest city founded in the continental U.S. It has a lot of history to offer, and so I'm very steeped in that. Um, I'm a big foodie. I've always been a big food fan, and certainly as we'll get into the impacts of my treatment on how I ate, what I could taste, how that whole process went. I can certainly speak to that as well. Um, I have an 18-year-old cat with a bad attitude, and I have, of course, my niece Carrie is a researcher in U of M's programs, and it was she who first approached me about the research that she was doing. She was excited and intrigued to say to me, Uncle David, I think I'm actually working on something related to making people's lives better who have gone through the same process you have. So that's as small an introduction as I can give of myself, but feel free to ask any other questions.
Thank you for sharing that with us. I know Carrie personally, we are best friends, and she always tells us your story as something that inspires her to do her research now. So, in the
Mhm.
beginning, when she joined the lab, she was interested in Xerostomia because of you. And she writes there on her personal statements and everything. So, you were very important to her. And this story went around. That's why we also invited you to come and talk to us because we know that your story was impactful for her career and that she feels good that she can do something back to you and to the community.
I appreciate that.
When you were talking, Dr. Warren also joined us. I didn't know if he was going to come because he was in the clinic. So I'll ask him to introduce himself briefly.
Yeah, hi. Thanks for having me. Yeah, just came from the operating room today. Sorry. But I'm a head and neck cancer surgeon at Allegheny Health Network in Pittsburgh. Uh, been here 6 years now. Actually did some training at Henry Ford in Detroit, so spent some years in Detroit. But most of my time is taking care of head and neck cancer patients from a clinical standpoint. But and involved from a research perspective with the University of Michigan lab and Rice University, mostly focused on salivary gland regeneration, looking at treating patients with radiation-induced xerostomia, trying to take technologies from, like we say, from bench to bedside as much as possible. And then I also do some quality and some outcomes research for head and neck cancer patients as well.
Thank you. Thank you for joining us. We were just getting to know David, and now I want to ask him to talk more specifically about the diagnosis and the experience with cancer. So you told me that it was 4 years ago that you got diagnosed, and I would love to hear how it was for you to getting the diagnosed, and also how was the treatment period of time, if you had any symptoms that you would like to share during the treatment and then after that, like symptoms that you still have in your day life today.
Certainly. Um, I think the best way that I can tell the story is just to do as much of the chronology as I can. In July of 2021, roughly mid-July, um, I was getting ready for a summer trip with a friend and her family, and just getting ready in the morning and noticed what felt like a small bump on the right-hand side of my jawline, so behind my lower jaw. And it didn't feel like anything overly concerning, but it was about the size of like a pencil eraser. And it felt soft, but it was definitely noticeable. And um, I thought, well, let's see what happens. I waited maybe a few days to see if maybe it was just a swollen gland or something like that that would correct itself. And it didn't. And I thought, well, let me check in with my general practitioner, and went in and was assessed by him. And he speculated that it was a blocked salivary gland, that it may be something associated with an infection. Excuse me, but without more, he certainly wouldn't be able to make any strong conclusions. So I had also had at the time, and I don't know if this is related or was ultimately related or not. I had some audible, at least internally, roaring sounds when I would stand up, when I would bend over, just it didn't feel like there was a change in blood pressure, etc. But I definitely heard the roaring in my head. And ultimately, that was unrelated. I still don't know what that was necessarily, but he said, well, let's send you for a CT, and let's also send you for an MRA. And I had never heard of that before. And he said it's, dealing with the search basically to see if there's any aneurysm potentially in my cranium. And so I learned a couple of things. I learned that I am claustrophobic. And even though there was an open MRA machine that was new to the Beaumont Hospital facility where I went, I still had initially a very hard time getting that test done. But we finished up, and I didn't expect to hear anything for some time. And approximately 2 days later, my general practitioner called, and he said, there's a concern about the morphology in what we saw in these tests, and I'd like you to get aligned with an ENT, and also consider what they have to say, but you should get this checked out. Um, COVID was still impacting how easy it was to get in for treatment or for tests, et cetera, at the time. Again, this is July, August 2021. And nevertheless, wherever I could go in the Beaumont system, wherever there was the testing available, whatever it was, I I jumped on it. So I ended up traveling around to several different locations in the Beaumont hospital system in southeastern Michigan and had all the testing done. Ultimately, having had a triple endoscopy. I also had a carotid ultrasound, and these all confirmed my diagnosis in mid-September of 2021 and I'd have to read it again, uh, malignant squamous carcinoma. And it was the primary lesion was on the left, or excuse me, the right side of the base of my tongue. And then they also identified discrete cell masses so certainly that mass in my lymph node, and then also along my lower jaw, and some actually down the sides of my throat. And uh, it's surreal to hear that and to read it. And nevertheless, okay, what's next? We launched into what's next. And so the suggestions were the advice after an initial panel had reviewed my case, a cancer panel had reviewed my case. My ENT had discussed with me a robotic dissection. I don't remember the full phrasing of it, but it was to remove the lesion at the base of my tongue. I think they were talking about the mass behind my jaw as well. And after discussing the potential side effects and the potential impact on things like my larynx, and my vocal cords, et cetera, and my tongue potentially, that it could have changed my speech patterns. As you might have already guessed, I'm a pretty wordy person. I'm pretty fond of language. I actually, as a lawyer, I talk for a living, much to people's dismay at times. Um, but all of that, all the prospect that that could change in a way that I just could never get back, we opted for uh, radiation and chemo. And that regimen started after a number of tests. Like I had a PET scan, I had a colonoscopy, I had all of the other ancillary assessments to make sure, I had an audiology exam, all of those things that I'm sure, all three of you understand are part of the whole, global assessment to make sure that whatever is proposed and then implemented, we're aware of other things that could be impacted. And so in October of 2021, I started 35 doses of radiation, and I can't remember the specific intensity, but 35 doses of radiation targeted, at these areas, and weekly chemo that was given through a subcutaneous port in my chest. And um, the chemo, interestingly and scarily, actually at the same time, just like other situations of which you may be aware, uh, the cure was projected to be worse than the disease in some respects, because the initial uh, prescription was for one of the platinum-based drugs, and of course the warning was, look, 80% of the people who have this, who receive this chemo may have some impact to their hearing. And then the other potential side effects, hair loss, etc. And I was, I'm vain enough to say that the prospect of hair loss was daunting, etc. And even though I knew it would grow back, that would have been worth the risk. The impact to my hearing, though, I was really concerned about. My medical oncologist had said, um, if I noticed anything that was if I had some tinnitus, and he said if that manifested before I started my chemo, he said I had to let him know immediately, because if that showed up, he said we're gonna have to use something else. We're gonna have to use some other sort of chemo regimen. And 10 minutes before I was to have my first chemo infusion, we're in the parking garage of Beaumont, and I had this incident of tinnitus, and he said, "Well, that's it. We can't do that. We'll have to think about something else." And I can't remember what they ultimately used, but it wasn't a platinum drug. It was an amplifier, but it ultimately, and you all would probably know better than I, Dr. Swegal, you might know better than I. Um, One of its main side effects is acne, and I think it started with an E, maybe.
Erbitux.
Erbitux, that's what it was. So not so. Um, anyway, so I went through those regimens. I started to have certainly the sore throat that came from the radiation treatments, um, and that was affecting my ability to swallow. And taste was affected probably within about 3 weeks. I mean, it happened pretty quickly. I did notice the changes in my saliva production about a month in, 3 weeks to a month. Um, and I was warned. My medical oncologist said, look, before this treatment starts, eat everything. Eat everything. Go on a food, journey, and eat every flavor, because once this starts, the potential is things are going to taste like garbage, or there won't be any flavor at all. And additionally, my swallowing would be impacted. It would be painful. And that certainly happened. And I started to lose weight because I couldn't, I was cautioned to keep my protein levels up, both for healing purposes, and my carbs up and calories as much as I could, because of the concern that if I lost too much weight too quickly, they'd have to recalibrate everything. I'd have to be remeasured basically for the mask that kept me immobilized on the board while they did the radiation. Um, got through the treatments. There was one, they gave me a break. I did have near the end of my treatments, I was about uh, 30 treatments in, 30 doses in on the radiation, and I was really uncomfortable. And they said, well, let's give you a break. So they gave me a break of a week, but that moved out my treatment a bit longer. And so I rang out in December 15th of 2021. I rang the bell, and the clinical nurses and my oncologist, all with repeated, um, what's the process? Is it an endoscopy with the little thin tube with the light at the end? So I had had multiple endoscopies and rechecks, checking progress over the months. And thankfully, I'd gotten to a point by December where my oncologist just looked and said, "This is wonderful. The results, the progress uh, of reducing and eliminating the lesions from what they could tell was doing exactly what they needed to do." But I still kept losing weight, and I was probably about 10 days shy of having to have my my whole dosage recalibrated because I lost so much weight. Lost about 40 pounds. I was at 30 pounds. I was at about 205 pounds, and I went down to about 170. After the regimen was completed, they of course said, okay, now what has been going on over the past few months, it may start to back up on you. And I said, well, what do you mean? And they said, well, your salivary glands will take some time to come back. And I'm sorry, Caio, I meant to mention because I'm thinking about all this and thinking about what you said about your practice. Um, my saliva went down to almost nothing. I had to, eat uh, everything covered in gravy or, soaked or whatever the case may be. And the and the oncological nurse said, you are going to have more mucus production than the worst toddler you've ever seen, than the worst child you've ever seen. And I was like a snotty child. It was gross, but I learned that the body compensates. What it couldn't make up in saliva, it still needed to moisturize my esophagus, etc. And it was gross. So in the months between December 2021 and March 2022, that's when the effects of the radiation really started to come through as well visibly, because I got, the equivalent of a terrible sunburn on both sides of my neck. And I started to have some um, desquamation on both sides of my neck, and I had to treat that. It was wet desquamation, and so I treated for that with various gauzes, and there was another, um, basically a desiccant that I was using to help with that. And by uh, March, I had a follow-up PET scan, and I had got an all clear, which was wonderful, and still was having residual effects. My taste buds, I would say, were about 90% back, 80 to 90% back. Still dry mouth though. Even as I'm talking right now, I can feel that my tongue is dried out. Um, there's a different tonal quality to my voice. I have a normally very deep voice. I can hear um, a bit of a scratchy tone to it, and I attribute that to my throat being dry. And um, I've had clear scans. I didn't have another PET scan, but I've had clear scans since March of 2021. Um, And knock on wood, I was saying to Juliana before we got started that it'll be 4 years in March, and hopefully all will continue to go well. But that's that's as much of a nutshell as I can give of that. I can tell you that, like I said, currently and since then, certainly dry mouth when I'm talking. I'm a mouth breather when I sleep. And so my throat gets very dry and sometimes so dry that it actually wakes me up, that it's so uncomfortable. And it's not just my mouth and my throat. I can feel it almost feels like indigestion, like down in my chest. And I don't know if that's dryness or what that might be, but it is a discomfort that is eased by having some liquid, typically water. That's about it. It's about, where I am today.
Yeah, so you were telling us some foods that you had like problems to eat, how it was the experience when you start to feel the dry mouth. How did you handle those situations at that time, like eating this kind of foods?
I think it's important to maybe mention the foods that I was eating. Certain things were just not appetizing anymore, but I would have things that I wouldn't normally eat just because I was trying to keep everything up, the proteins and the carbs, etc. Um, it turns out that I never want to see another protein drink ever again in my life. They're wonderful. They certainly are helpful. I can't even look at them anymore. And then ultimately, what was my meal of choice turned out to be a piece of toast with butter and a couple of fried eggs. And just the moisture that was in certainly the eggs was helpful. But to compensate for the dry mouth, again, drank a lot of water. Anything that was drier, like things like chicken nuggets or whatever it was that I could tolerate, I was dipping it in some sort of dressing or some sort of sauce or something like that. Ultimately, it was so uncomfortable to try and eat anything that solid or that dry. The surface was that dry. I just stopped eating them altogether. So I did eat oatmeal, steel cut oats that had been cooked, overnight or made overnight. So they were fairly soft. And again, added something to them. So I added either, milk or creamer to them. Um, Yogurt, I ate a lot of yogurt. I really, doctor, I just did whatever worked but it was mostly water, mostly softer foods, and it didn't really replenish my saliva, and I felt a lot of times like I was fighting against the tide of just, like I said, incredible amounts of mucus that were being produced to try and make up for the lack of saliva.
Do you still make food choices or pick foods because of your dry mouth?
Uh, no, no, not so much. Certainly my mouth still gets very dry. There are times when if I don't chew enough, it's uncomfortable to swallow. It doesn't hurt. It feels impeded a bit. Um, I do find that, and this is more of a taste thing, um, salt, I actually need more salt flavoring to appreciate salt in my food. And I wasn't a huge spicy food fan. I would eat maybe mild to medium spicy in the foods that I would have, depending on what it was. And now I prefer something that's medium spicy or hotter, which is hopeful to me because I thought it would go the other direction. But to answer your question, Doctor, no, I don't really limit the things that I eat, but I can tell that my mouth still gets dry, and I still have to be more mindful of how I chew it, how I cut it, how I will swallow it. So.
So, did you use any kind of medication or artificial saliva to help with the dry mouth sensation?
I used, and it was really, I think it was twofold or multifold why the suggestion was to use biotin, and both because I primarily was breathing through my mouth, but also because I wasn't producing a lot of saliva. And the concern about my overall oral health, my mouth health was a concern. I don't know if that helped saliva, but it certainly was more for the care of my gums against whatever periodontitis, whatever else it might be. But nothing that I can recall as far as any other kind of prescribed medication for dry mouth.
You just mentioned that you were using this more for your oral health, like the gums and everything. So when that started, did you notice an increasing of cavities or gum issues? Your oral mouth was affected in that way? Were you having follow-ups with dentists, or was just more your care, like the oncologist care?
I did have regular follow-ups with my dentist. I did notice that, and even now, I mean, it's something that I've had a history of periodontal disease, and it just over the course of my life, and actually had some significant periodontal work before I started my treatment because of everything that could potentially impact. And so I had some hyperplastic gum tissue removed. Um, I had a cavity while I was going through that, through that pre-dental treatment. Since the diagnosis and treatment, um, I definitely have, I have the inflammation. It's not as pronounced as it was, years ago or even before my cancer treatment. Um, and I think knock on wood, no cavities since then, but certainly my gums are my gums are a little inflamed, and my teeth are actually a little sensitive. I can't remember if the the treatment had an impact on uh, or increased the amount of grinding of my rear teeth that I do. Um, but no, yeah, thankfully not many cavities, but certainly the gums are because of all the mouth breathing, etc. It's a challenge.
From hearing your story, I'm very happy for your team together. I can't speak as an oncologist, but as a dentist, I feel like you had a good support of professionals with you. And I don't think that's something I listened a lot when you told us that they decided not to go to surgery, but do chemo with radiation because that would be best for your life. Because
Right.
you were a lawyer, you have to talk a lot, and having the surgery in your tongue could be very impactful for your daily life. And in that way, I wanted to ask you, thinking about your daily life and also your social life, how did it impact you? Not just about your health, but your well being and what you like to do during that period of time.
It's a really interesting question. I don't know that as far as my life and my social life are concerned, that it really changed them. I think actually because of COVID and kind of the really social dynamics and the changes that were brought about by COVID, I had started to work remotely mostly. I'm part of a partnership here in southeastern Michigan, but 90% of the time I'm working from home. And again, I think that was really based upon COVID. Yeah, I don't think I felt I mean, I felt comfortable being around people, and being at family occasions and life occasions, and was not really uh, and am not really concerned about what I drink or what I don't drink or what I eat or what I don't eat. Or I am aware, again, whether it's vanity, it's not really a health concern. I am aware of that change in my voice that I mentioned, sort of that scratchiness in my voice, and I'm aware of it. I don't think anybody else really pays any attention to it. And then additionally, um, even though I have dry mouth, right now I can feel, and at times when I am talking, it almost feels like in the front part of my mouth, on my in the lower part in my lower jaw, like there's too much saliva, like around, like on the sides of my tongue and on the front. I almost feel like there's a I don't know how to describe it. There's a dampness, or there's a not a breathiness, but really like there's too much water in my mouth, and it's essentially near the front of my mouth and on the sides of my tongue when I'm talking. And so I am mindful of that. I can hear myself now when when I'm in a meeting like this or when I'm on the phone. I've heard my recorded voice recently, and it almost sounds like a lisp to me, and that's the best way I can describe it. So other than that, not major impacts. I didn't really stay because of my treatment, because of my follow-up, etc., and the experience. No real negative effects as far as feeling isolated or uncomfortable or unhealthy. I mean, actually, anytime people saw me, they would say, "You went through cancer?" I said, "Yeah, I did." And granted, this is not necessarily the kind of cancer that has, real outward manifestations, but whatever anyone's image of cancer and cancer treatment are, people say, "Oh, you look fine. You look like, you look nice and healthy." So other than that, no real impacts in that respect.
So I'm glad about it. And we cannot notice your voice. Your voice
That's
sounds perfect for us.
that's
I
Thank
can't
you.
imagine how hard it is for you to notice this and keep it listening to yourself and thinking that your voice is different. But for who doesn't know, it's
Don't,
completely
don't
perfect.
tell anybody. Don't
I won't
broadcast
tell
this
anybody.
podcast.
I'll
Don't tell
cut
anybody.
this part out.
I appreciate it. No, it's fine.
Um, and you talked about the saliva that you feel in the lower part of your mouth. Do
Mhm.
you feel the saliva is thicker than it was before?
Um, I don't know.
You don't know?
Yeah, I don't recall.
Okay.
It just is noticeable to me. It's almost when I am talking for a while, surprisingly, as opposed to my mouth drying out, it feels like there is more saliva in those areas in the lower part of my mouth. And I'm aware of it, and I don't want to spit on anyone when I talk, and don't, etc. So
I'm sorry I'm making you speak so much.
no, I'm
Making
happy
your
to do
mouth
it.
dry right now.
No, I'm happy to do it. I have water on hand. I'm good.
Yeah, so
So
you can feel the saliva producing saliva, but it's a saliva that does not wet your mouth, right? It doesn't make you feel like you are like humid inside. Just it's accumulating.
Agreed. Yes, the
Okay.
answer is yes.
um, you mentioned before that you had like noticed this difference in the sense of the taste of food. So did you still noticing like the difference from when you start to have the dry mouth from now, or it changed it again?
Um, and I can tell you that the change in taste during treatment, during active treatment, um, was certainly noticeable, certainly was happening at the same time my mouth was drying out. Um, After my PET scan in March of 2022, um, I can say that my taste buds were largely improved. So probably uh, 70-80% back to what they had been pre-treatment. Um, My mouth has always been dry though, right? And I don't know it's never been terrible, but it has never in the 4 years since I rang the bell, um, it's not gotten worse, my dry mouth, but it's also not gotten better. It's still the symptoms I described before. It's the when I'm sleeping, it's very dry. When I'm talking, and that feeling of uh, almost feeling like a burning sensation, but it's just a very dry throat that I wake up with out of my sleep.
Can I ask, and I think it applies to all of us as we think of ways to fix this for patients in the future. What what would you be willing to do if we could fix your saliva? Meaning, if it was a pill you had to take every day, would you take a pill every day if it meant you didn't have to deal with dry mouth? Would you undergo a surgery if it meant you didn't have to deal with dry mouth? In a sense, how bad is it, and what do you think you'd go through in order to?
It's a very interesting question. Very interesting question. I had not really considered it. Um, I think probably a pill or some sort of non-invasive, even though you're ingesting it, some sort of non-invasive solution as opposed to surgery. Um, and that's just generally, I mean, hospitals are fine. No one likes to be, I mean, I know that this is a professional venue for you all, but I can't imagine that you all like being patients in hospitals or in medical centers if you don't have to be. Um, and so part of it is that, and then two, um, I I I don't relish the thought of being operated on. And it's also not so bad, doctor, that well, I guess that's a question. If it got worse, if the dry mouth and the dry throat, et cetera, just became uh, less tolerable than they are right now. They're not terrible right now. It's noticeable. I notice it. Some of what I'm noticing, as I mentioned, is I think vanity on my part. But there is discomfort, and I think the lengths I'd be willing to go right now would probably be um, some sort of oral treatment, some sort of either, a pill or some sort of solution or something like that, as opposed to surgery. It's not as dire as, if I had mucus everywhere again, yeah, I'd probably consider something more than that.
I appreciate that. It's kind of figuring out what that risk benefit is for
Hmm.
patients. It's definitely a calculus that all patients have to go through. When you're considering treatment for your cancer, whether it's surgery or radiation, or if it's to take care of some of those long-term side effects.
Yeah. Yeah. I'm hopeful that things will continue to improve. Some of what I'm experiencing right now, I think is dietary and self-care. I've gained some weight back. Um, Probably should avoid the aisle with Doritos in it, at the grocery store. Um, but otherwise, I am hopeful that even things like uh, tea with honey, things that are not astringent necessarily, like an herbal tea as opposed to as a caffeinated tea or a tannin-based tea. Um, Again, it's not so bad that I'm thinking, geez, this is just I can't stand this. It really, I would say the most uncomfortable aspect is waking up at 3 or 4 o'clock in the morning and my throat is so dry, I just can't stand it. So,
Looking back, David, do you think is there anything that you could do that time, like that you could do differently to prepare yourself to the dry mouth sensation, how to manage it?
Um, Maybe. I mean, maybe get used to like the biotin. And it's not that it was terrible. It was fine. You know, the flavor was fine, what I could taste of it. And maybe start to get used to that routine and maybe using biotin on a regular basis. Um, Starting to consider uh, what foods were more palatable sooner because it was kind of a trial and error, you know, once I got into the treatment and the effects of the treatment. I figured it out pretty quickly, but maybe God, there's so much information, of course, that they throw at patients necessarily, and maybe uh, concentrated a bit more in that area because it certainly was it was that was a tough one. You know, the pain was one thing from the radiation, but the really the gross way I felt with the dry mouth and with the mucus, I wish I had gotten ahead of. And I think it's a really important question, is I would have prepared more maybe for softer foods, more liquid foods, and just generally prepared myself mentally that this was coming, potentially.
As you were telling me in the beginning, I don't even know if we were recording yet, that when you were there, you don't see anything, you don't listen to anything anymore, right? You have someone that is there with you because you're just so overwhelmed with everything that it's
Right.
hard to keep up with everything you have to know and do and all the new information you're getting from all those doctors. I can't imagine how it is. I can't imagine how it was for you to go through all this. I'm glad that you are free for 4 years and you have your follow-up now, and I have my fingers crossed that everything is going to be okay.
Yeah.
I love to know about you. I love to listen to your story, hear you. Um, I am always the person who has to wrap up this conversation, so I'm always the boring one that has to close. But I want to ask Kyle and Warren if they have any other questions they want to ask or any reflections they want to give us. And then I'll give you the word again, David, and you can tell us your final reflection on all this.
No, I want to say thank you for your time and your insight, and definitely appreciate it. Thank you.
You're welcome. You're
Yeah,
welcome.
in the same way, I want just say thank you to Juliana for inviting me, David, for like bring your experience, because I think this is very important. Like, it's this kind of contact that we have with the patients that push push you to make more research to help more people that is suffering with the dry mouth.
Thank you. No, and you're welcome. I I I was hesitant just before I logged on to the meeting today, um, because I didn't know how I would feel telling the story. I did find that I did not tell many people except very close friends and family when I was diagnosed. And it was not out of a sense of embarrassment or anything like that. I think it was that initial feeling like, one, I didn't want to be identified by my diagnosis. And then two, it's a really scary story for me. It's a scary story for anyone. I didn't want to tell the story. I didn't want to hear myself tell the story. And so keeping that experience limited was helpful to me. I will tell you that I know how fortunate I am. I know how fortunate I am that it was diagnosed when it was, that I had a tremendous treatment team from the receptionist at the front desk at the oncologist's office, you know, all the way to the highest levels of the medical providers. And then also including like a lot of hospitals, um, Troy Corwell now, Corwell East, I think it's called, has a cancer support center, and the the nurses and others who staff that center are they are lights in the darkness. They really are. Yeah, but it's a whole combination of things. And I'm grateful for all of you, truly. Not even, I mean, Juliana, I met briefly at my niece's wedding. But the fact is, um, this is not just your profession. This is not a hobby for you. This is, yes, you are scientists, but you are also dealers in compassion and kindness because you're treating humans. This is not, well, Carrie's maybe dealing with rats, and maybe you guys are as well. But you're treating humans and humans with real reactions and lives and desires and ambitions for themselves and their loved ones. And I appreciate all of your focus and care that you're bringing to the profession. I'm saying that as a survivor and a hopeful long-time survivor.
Thank you so much for sharing that. I really appreciate you being open about this and about how you feel sharing this with people that are not your family and closest friends. For us, Caio, me, and Warren, this is something we talk about often, but clinically or in a research view, we don't really talk about this as often in the emotional side. So I like to hear from you and get your perspective on this. And it's also different when we talk to one person and another person. The ideas are different, the feelings they had are different. So I like to hear from you too that what is your preference if you'd have to take a medicine for xerostomia, as Warren asked you, and probably another patient is going to answer that in a different way. So it's good to know different people, and then we can do our work better too in the clinic and in the research side. So I really appreciate you sharing all of this with us. I think this episode is going to be, I can't even tell. I think everybody's going to appreciate that you're sharing this with us. I want to bring more patients too, so we can hear the experience from different perspectives and also different conditions that are related to what we do. And then we can share this feeling of belonging. We belong to this all together. And what we do is to try to make humans' life better. And even if you're working with rats right now, has a goal, and it's good to know that our goal matters for you too.
It does.
Yeah.
It does.
Thank you so much for your time.
Thank you, doctors.
I also want to thank our moderator, Caio, that jumped in with us in the beginning, and also Warren, that I was not even expecting him to come because he was in the clinic, he was in the OR, but he came anyways, and he was able to share this moment with us and put his insights too. So thank you so much, Caio and Warren. I also want to thank everyone listening. If you enjoyed this podcast, please follow the podcast on YouTube and Spotify. Share this with others who might find it helpful. I think this is a special episode that we can learn more from a different perspective. And we will continue to explore research, care, and the human experiences behind all this we do. Thank you so much, and see you next time. Bye!